Welcome. In this video, we'll be discussing the vascular function curve. Now, the function of the heart and vessels are coupled as seen in the animation. And the vascular function curve is produced when the cardiac output is controlled and the resulting change in central venous pressure is measured. Now, let us suppose if the heart stops beating, the blood is not pumped into the arteries but continues to flow into the veins as seen until the pressure is equalized between the arterial side and the venous side. Now, if we restart the heart, the venous pressure will drop as blood is almost sucked from the veins into the heart. Now, vascular function curve is actually a combination of the two curves. Firstly, we'll discuss the cardiac output curve. In this curve, we'll plot our cardiac output on the y-axis and our right atrial pressure or the central venous pressure on the x-axis. And this is what your cardiac output curve looks like. Now, if you look at it closely, it is very similar to your cardiac function curve. Check out the video on the same. The link is in the comments. Now, right atrial pressure actually determines your end diastolic volume in the right ventricle. So, it is a good enough surrogate for it. And cardiac output is directly proportional to stroke volume. In fact, in a lot of textbooks, the term cardiac function curve and cardiac output curve are used interchangeably. So, in all essence, this curve will behave in a very similar fashions, and all points on the cardiac output curve have the same contractility. Now, if we give the patient an inotropic drug like digoxin or during an exercise, the contractility will increase and the cardiac output curve will move towards the left. And if there is a reduction in contractility, then the cardiac output curve moves towards the right. Now, one of the factors that affects the contractility is your afterload. Afterload is actually the load on the muscle during contraction. So, in terms of heart, it implies the force that the muscle of the left ventricle must generate to eject the blood into the aorta. And this afterload is directly affected by your mean arterial or aortic pressure. So, in case of higher arterial pressure or high blood pressure, the heart has to work extra hard to pump the blood into the aorta. Now, the second curve here is your venous return curve, and we will impose this on the same diagram. We will plot our venous return on the y-axis. Now, if we look at this curve, we will see that our venous return decreases on increasing the right atrial pressure. Increase the venous return by either increasing the volume of blood in the veins, by reducing the right atrial pressure or negative right atrial pressure, or increasing the sympathetic tone of the veins, which will result in venous constriction, resulting in milking of blood into the heart. Now, in case a patient is given IV fluids, your venous return curve will shift to the right. That means there will be an increase in the venous return. In case of dehydration, the venous return will shift to the left as shown, and there will be a reduction in the venous return. Now, normally there is always a point of intersection between the cardiac output curve and the venous return, where your venous return is equal to cardiac output. And this point of equilibrium will change depending on various factors. Let's quickly look at two situations. So, in case of hemorrhage, what will happen? There is a loss of blood volume. So, your venous return will decrease. So, your venous return curve will shift to the left and your point of equilibrium will move from N to A. Now, note that the contractility remains the same. However, to compensate, to maintain the cardiac output, the heart increases the contractility and then your vector will move from point A to point B, which is the new steady state. Now, let's see what happens during a systolic heart failure. So we all know systolic heart failure is due to a reduction in contractility. So your contractility curve move towards the right. And the vector, the new stability point will be point P. Now to compensate, the body will try to increase the volume of blood in the veins through the angiotensin mechanism, and your venous return curve will increase and your vector will shift from point P to point Q. Point Q is the early stage of heart failure. In the later stages, the venous return increases and the cardiac output falls. So your new steady state will be at point E. Now it's time to put our understanding into practice. Please pause the video and go through this question and try to find the answer. Let's understand what is an aortocaval fistula. It's a direct connection between the aorta and the vena cava. So that means the blood has an entire new pathway to travel. Instead of going through the tissues and then getting into the venous circulation, here it is directly engorging the venous circulation. So what will happen to your total peripheral resistance here in the arteries? It will drastically drop. That's why we see a stark reduction in your diastolic blood pressure. Now, if so much of blood is engorged in the venous circulation, your venous return will increase substantially. Now, if the venous return curve is increased, your cardiac output will also increase. And the only point amongst the given options here, which meets both the criteria, is your point A, which is your correct answer. Point B is not a steady state. C is a steady state, but there is a reduction in both your cardiac output curve and your venous return curve. I hope this video was helpful. Thank you.